Hello and welcome to the Bald Ambition Podcast. I'm your very bald host, Mookie Spitz. And the one with ambition today is Mr. Matthew Stern. He is the CEO of MyStart Health. Welcome aboard, Matthew.
Thank you, Mookie. Great to be here. Thanks for inviting me on.
It's awesome to have you today because we live in a time of epic disruption. Look at the news. Doom scroll yourself into oblivion. Culture, politics, health and wellness. It seems to be shifting out from under us. There's a lot of confusion. People are scared. There's tons of misinformation. And it's lovely to have you on today because you bring together, in a sense, a perfect storm of entrepreneurship, health and wellness chops, and from what I can tell, a sweet white space of opportunity for bringing about effective change for the better. Can you tell us a little bit about yourself, your journey, your company, all at once?
Yeah, bring it on.
Take your time.
Bring it on. Yeah, thank you, Mookie. I think, we do live in an incredible time of opportunity, and I think it is this kind of like climactic moment of where technology is just continuing to accelerate at such a pace that it does create a ton of opportunity for industries that have historically been in the dark ages in terms of technology and evolution. And what that does for us as a society is, leads to hopefully amazing outcomes. I think people get scared by these changes in politics and these changes in technology, and they want to say that the sky is falling and the world's ending, but I think it's actually the greatest moment to be alive. We are living in a world where this evolution in AI and technology is going to lead to people living longer, happier, healthier lives, assuming we stay ahead of it, right? And we continue to use the technology the way that I believe, it has the potential to change lives, and lean into it in that way, which, there'll always be the outliers that use it for wrong. But I think the opportunity to use it for good is, people living longer lives. And that's our intention. So, I guess my background, real quick, like my expertise as an entrepreneur is really in growth and helping businesses design strategies to grow from 0 to 1 and beyond. So how do you take a company that's a concept and bring it to reality? And then how do you take it and build it into a real business that has scalability? And I've chose to apply that across a lot of different industries over the last 20 years of being in digital marketing. And I felt like the best application of what I do and what my experiences in business is in the healthcare vertical. I feel like it's a unique opportunity to take what I've learned over these 20 years in different businesses and apply it to a space where we can deliver innovation that reduces costs, increases access, and creates tremendous outcomes for people that really changes their lives. And I'm seeing it happen. Like we have these, such cool stories. I've never been more energized about anything I've done in those 20 years than what I'm doing today. Every day.
Well, it's great to have a guest who's Pollyanna. You're the anti-Chicken Little. So the sky is not falling, folks. And actually, it's looking pretty bright. What infuses you with this optimism? Specifically, what do you do and how do you do it differently that can bring about this optimistic change?
Oh, man. I think there's, to me, there's not really another way to live. I think it is the path. Waking up every day. I actually heard a quote from another guy that I follow in like the personal development space that he said he spent time with Wayne Dwyer. And he said like every time he would roll out of bed, he would say, thank you, thank you, thank you, as soon as his feet hit the ground. And like, that was this week. I heard that on like yesterday morning when I woke up. I was listening to his podcast, and man, I heard that and I was like, I need that. Like that's a new one I'm adding to the morning routine, because that's it, right? It's like coming from a place of gratitude that like every day is not given. And I think about my mortality probably more than I should. But that's the reality of it, right? My dad passed away at 64, and it gives you this perspective that like life is really short and you never know how much time you have. And so I treat every day that way. I treat every morning that I get with my daughter and every day I get with my wife and every moment that I have with the team that I'm building in this business is like a unique opportunity to be alive and drive this business forward, which, then when I get to have conversations like I did last night with one of our customers, it just like lights me up.
That's terrific. And I agree categorically. Gratitude is the great salve. And I think as a society, we lack that sense of appreciation. If you really look at the metrics, never in human history has a society lived so well
Yeah,
comparatively. Level of education, level of health, although we have our issues, right?
we're
And
getting better.
overall quality of life, longevity is incomparable, and yet we bicker and complain and bully and nitpick over
Yeah,
everything to the point where we've whipped ourselves into this frenzy of dissatisfaction. When, to your point, if we could just inhale a little bit and exhale and appreciate the things that we have, then our day would be ready to do good things instead of perpetuating the myth that we're heading into the toilet. So
yeah.
I think that attitude is wonderful. But underneath, what fuels it for you in terms of what your company is doing? Whom are you
Sure.
helping? How are you helping them? And how is it something special and different that our listeners would find compelling and perhaps even participate in?
Yeah, absolutely. So MyStart Health was founded last June, and we started, bringing onboarding customers to the platform in August last year. And we started with a telehealth platform that was connecting individuals to doctors in all 50 states across the United States and delivering GLP-1 weight loss medications directly to your door and doing it at a fraction of the cost of the branded medications that are out there like Ozempic and Mounjaro, that have gotten all the press and news and have also changed millions of lives. And the premise for me was starting with something that I was seeing just around me, right, with friends and family, and seeing the impact these medications were having on people's lives, and really their hope and their aspirations and their like excitement for life was shifting as they were losing this weight, because a lot of these individuals have tried everything, right? They've tried every crash diet, they've tried every um, exercise program that they could do, that gets hot for a moment and then gets really difficult to continue. And this is the first time that it's been a true evolution in the way that people access weight loss and they're able to maintain it consistently. And then it starts to shift the other habits around eating and exercise, hopefully, right? Hopefully it comes with that shift. And if it does, it's absolutely life changing. But it becomes like the catalyst that creates that momentum for people. And I was seeing that with friends and family around me, and then I was seeing businesses pop up around uh, what I'd say like my industry, like the internet, right? Like seeing like businesses pop up, and trying to execute this model, and I just saw holes in what they were doing that created an opportunity for MyStart to do it a little bit better. Deliver it a little bit less expensively, with easier access, with a little more technology, and we're still learning. We're still growing as a business. We've had tremendous growth over the last year, and it's really like more exciting every day. But we still have a long way to go. I think, my intention for the future is to get more personalized in how we deliver care and how we deliver recommendations to our customers, and to offer additional services that continue to expand the longevity and lifespan and health of the individuals that we help and service. And that's really our commitment and where we're going over the next 6, 12 months as we grow in this business.
So if I'm hearing you right, you are a telemedicine or telehealth connection channel, if you will. So if an individual is
Yeah,
seeking a GLP and you are able to connect them virtually through their computer, through their phone with a PCP, an endocrinologist, which
you got it.
specialties are
Yeah.
you connecting?
So at the moment, we're focused on, there's no specialty, right? It's a general practitioner, or a nurse practitioner that, we connect you to, that's licensed in. We have staff across the country, right? So we have individuals that are licensed in all 50 states, and we have pharmacy partners that are delivering direct to your home within 2 days of ordering. So you come to MyStart Health, you can qualify in about 5 minutes through our initial survey or initial assessment. Then you will pick the program that you're interested in, which medication over which time frame. Like, we have an incredible program right now where you can pay for 3 months and receive 3 months of medication directly to your door up front, which is amazing from a titration, which is like the schedule in which you increase your dosage over time and grow with the program, to get that directly to your door within 2 days. So it's an incredible customer experience. And, we have a great patient portal where you can log in and communicate directly with the provider, with our patient care coordination team. So we're just continuing to expand that and make it like easier, more accessible. And yeah, it's working.
I'm sure the first question that a listener will have is, do you integrate managed care, so insurance coverage, or is this an entirely private service?
Yeah, it's all cash pay in this moment.
Okay.
For people that are fortunate enough to have like amazing healthcare and health coverage in this country, I think lean into that 100%. Like, I have a friend who's on Kaiser here in California, and Kaiser has done a great job with their patient base of being proactive and trying to get as proactive as possible with healthcare. I think they've recognized the value in doing that, and they have a vision for the future of what that means to their population that they're managing. Unfortunately, other groups like Blue Cross of Michigan have stopped covering it altogether because their fear factor around their stock price, right, and what they're reporting to the market is so great that they can't have a long-term vision for their patient population. They can't afford it in the short term. It's going to bankrupt them. And that's also, this inability to be flexible in our healthcare world, and like all the barriers that we put into our healthcare system around branded medications and patents and those kind of pieces, where big pharma really has all the leverage. They have the ability to charge the insurance companies $1,000 to $1,500 a month for these medications. And that drives the insurance companies to the point where they can't cover it for their population. So that creates the market opportunity for guys like us, right? To offer an alternative solution.
And from a HEOR, or health economics outcomes research point of view, the benefit of the GLPs, every pound that a person is able to take off translates to epic savings for our entire healthcare system, our entire economy. Look at all the comorbidities associated with high BMI. I mean, this has been documented, and it is a shame. And again, we could sit here for the next hour and discuss the failings of the American healthcare system. But the whole point, though, is entrepreneurs and health conscious people like yourself create opportunities like your portal and your telemedicine channel for people who want a GLP and can save money and save time and expedite that process. And it sounds to me like really a matter of days they could get hooked into it and connect with a doctor and get the treatment and start losing weight for their benefit. And I think most significantly for all of society's benefit, because again, the impact is just so enormous.
I completely agree. I think individually, if, like you said, I think there's an incredible impact. If you can, there's a statistic out there that the moment you're diagnosed as diabetic, you lose 16 years off of your lifespan. And so doing everything in your power to avoid that diagnosis, I think, is hugely empowering for the individual. So that's one piece of this. The other piece that you spoke to, like around the other comorbidities, I saw my dad go through it, right? At 64 years old, he had always kind of carried a belly, always had high blood pressure on check, never went to the doctor. And I believe if he had access to this, he'd still be alive. Like, he wound up kidney failure, heart failure, in and out of the hospital system for over 2 years, multiple surgeries, like the hundreds of thousands of dollars that to support his life for the 2 final years that were not good years for him. But it was hundreds of thousands of dollars on our healthcare system, probably millions of dollars on our healthcare system for one individual who, for, a few $1,000s a year, could have resolved a lot of that, because he was active. He was into exercise. He was into, I think there were challenges with food, and there are still challenges with our food system that I think people that through the 80s and 90s with processed foods, which we could probably also spend an hour on.
Oh,
He was part of
yeah,
that
at
population
least. Yeah.
that just wasn't educated on it and didn't know. But I think these medications could have absolutely changed his life, and he would still be here.
Absolutely. And the fact that you're facilitating access, and it sounds to me like reducing costs. If an individual did not have coverage and they had to go about gaining access and paying for these medications, it sounds like it would be rougher sailing than simply to sign up with MyStart Health,
I
connect
think
to a
so.
doctor, and then get the process going.
Yeah, I think so. We've gotten very competitive on our pricing. We've really dialed in the operational piece of what we do and gotten it streamlined to the point where I believe we deliver one of the best experiences at the best prices in the market.
Yeah, that's excellent. As you can see, I got a Peloton in back. We have a history of type 2 diabetes in my family. And so I'm health conscious. I actually
Yeah.
enjoy exercise. It helps with the dopamine
Yeah,
deficiency.
absolutely. I think when
But
we spoke before, I had the treadmill, treadmill and the bike.
right,
So
right.
yeah, I'm a
So
big believer.
So we're big believers in exercise and diet, but there are, frankly, and this has also been documented, there's reams of data and research that people who have trouble with diet, some people who are we could consider naturally obese, it's not an expression of will. You can't wake up in the morning and say, I'm going to be skinny.
Yeah.
So the GLPs have demonstrably revealed that folks who historically have had difficulty with diet, with weight, are finally able to lose the weight they always did without making those compromises or without constantly oscillating. Folks go on a diet, they lose the 20 pounds, comes back, and it's not only an anxiety creating churn, but it's unhealthy. So it's great that you're making these available and you're making them affordable. We were also discussing a segment, a target audience that you're also focusing on, that you've got experience with. Can you talk a little bit about some of your experience and history and how this translates to providing benefit for certain types of patients who are in certain types of need?
Sure. Yeah, I think we're continuing to, like I said, evolve as a business and recognize where the market's moving and where we can make the biggest impact. I do think I appreciate you recognizing how big of an impact GLP-1s are making on the general population. The next population of folks that I think have been completely underserved are the women in our lives. I think, most of the telehealth companies that have been created so far have been created for men by men. They started with like getting access to Viagra, and that was like the Hims and Roman and these companies. And I was actually in the telehealth space in 2015 as well. So like totally get it. And I'm not, immune to the fact that I'm a guy as well creating this business. Right. So, but no, I've seen what I've seen in the evolution of my mother getting older and what my wife's currently going through, 5 years after having our baby, is just a total lack of education and a support from the healthcare system, from the like traditional healthcare system. And when I now look at my mom's health, where she has osteoporosis that is pretty bad, and they've got her on medication, it really tracks back to the 90s when the FDA put a black box warning on hormone treatments for women, based on a study that said that it would lead to higher breast cancer outcomes. And just at the end of July, the FDA hosted a panel with women's health experts that challenged that directly. And I think the FDA is now willing to reconsider that stance that they've taken, that actually being on hormone treatment as a woman, going through perimenopause and menopause, can really proactively get ahead of heart issues, bone density issues, and weight loss that can shift your entire future in how you experience life. And we're talking about sleep, brain fog, strength, and energy. What I'm calling I call it our Rise program that we're going to be launching in Q4, which is all about reigniting your intimacy, strength, and energy. and it touches on all areas of your life. And it's the idea that like, yeah, that women in the current traditional healthcare system, like you go to your doctor, you get blood work done, and the answer is, looks great. Yet the women that are closest to our lives are, so you're being told everything's fine, you're good, but they're not sleeping well. They're not feeling like themselves. They can't get their body back like the way they want it. And they can't experience life in the fullest that they've experienced it when they were younger. And like, that's not it. That's not fair. Yet guys can pump testosterone in their system. And at 60, look like they're 30 and jacked. Like, what? That makes no sense. So that's the evolution in this market that's coming that we're going to absolutely be a part of. What I've recognized is, about 85% of our market in GLP-1s is women, especially with MyStart. And our population, because we have the data, is between the ages of 35 and 65. And so, that is the demographic that we're serving. And so if I'm thinking, what is the most impactful way that I can help the people that we're already helping? It's through hormone therapy and getting, again, same process, right? It's education, access, and affordability. And if we can nail those three things, we're going to be hugely successful. But the education piece starts with getting women around this that have really experienced it and can speak to the impact, because that's where all the education comes from today. It won't come from the traditional doctor. It won't come from the traditional healthcare system. It has to come from other women that have stood up for that, continue to stand up for other women and speak to their story. And we want to empower those women. So we're aligning ourselves with women's health experts that are doctors across the country that are willing to use their platform to speak up about it. My goal as an entrepreneur is to empower them with the technology and the capabilities and the platforms to do that, and then to bring other women around this that are also willing to create community and help uplift each other to the solution. And if I can do that, I'll be very successful in business, but I will feel so good about my ability to help my wife, the mother that I have today. And like, I think that's it, right? Like, if I've been able to find something in this business, that's what gives me the energy, is like, I've been able to find something that finally I feel like I can leverage all the skills that I developed and apply it to something that like really moves the needle for people. And so I just want to keep leaning into that.
Yeah, that's the wonderful thing about healthcare. Whether you're on the marketing, digital advertising, communications, PR side, or whether you're doing a great startup like you are doing in terms of access and cost, it's not like a consumer packaged good or a vanity project.
Right.
We're certainly not selling cigarettes here, or even automobiles or Louis Vuitton bags. It's about health and wellness. It's about ensuring a certain quality of life and extending life for people. So it's got good karma. And I love your holistic approach to this, which is not like here's HRT. You want HRT, you can get some HRT. But there's a person behind the need. And to your point, hormone adjustment for a woman, especially later in life, isn't just about hormone adjustment for the woman. It is a holistic approach to every aspect of their life, their relationships, their energy level, how they interact with family and friends. And I think your approach makes a lot of sense, and you're providing a valuable resource, not only in terms of potentially providing HRT in ways that circumvents an otherwise deficient or broken healthcare system, but you're providing that overarching resource that I think is also lacking, especially for women. So that sounds terrific.
I think the bigger opportunity is in the community and education piece. For us, I think the HRT will create great outcomes. I also think technology has created this opportunity for us as well, where women are complicated. I don't think I fully appreciate like what we're signing up for here, because every woman is unique and is going to have her own journey and her own piece. But like you let off kind of like with this inflection point around technology when we first started talking. And I think that's our challenge as a business, but also our opportunity is to really understand every woman at a unique patient level. And based on the data that we have, and we can continue to capture, leveraging AI and leveraging the technologies we have to deliver true personalization down to the medication level, I think is a tremendous opportunity to create great outcomes and to build an awesome business at the same time.
Yeah, people have been talking about personalized medicine for decades, and the
Mhm.
technology, especially digital technology and now artificial intelligence, has caught up to that
Yeah,
inspirational, hopeful kind of vision. We've got 37 trillion cells on average in everyone's body. And
yeah,
everyone, to your point, is unique: male, female, young, old, what have you. And catering to the individual is really what it's all about. That's what medicine ultimately should try to do. And it sounds like now's a great opportunity to plug all this in. You know who your patient is,
exactly right.
and then you provide as much information as you can. And then you provide a resource that isn't just access and affordability, but a connection and a relationship, to your point, community, to bolster them up. So it is
Yeah,
that perfect storm. But to the point you made at the beginning of the conversation, it's not like it's the end of the world because AI is going to take over. Well, until it does, maybe we really can enter a golden age of individualized, personalized experiences, either in media, entertainment, and most significantly in health and wellness.
yeah. My belief is that it's both. I think that the human experience is actually amplified as well because our desire for that human connection and the human like community piece is also going to be amplified over the years as we continue to grow with the technology. So my hope is that, yeah, it is this inflection point where we have the capabilities to go fully personalized and leverage the data. And at the same time, you know, people are going to be seeking community and seeking connection and human. And so we need to facilitate that as well and keep that at the forefront of how we build product and how people experience the brand and their relationship to us.
So, what is the user experience like? How is it now on your platform? If you could take folks through what it's like for the
Yeah,
GLPs, okay? I'm this bald guy. I'm in Orange County, California, and my coverage stinks. And I think it's time for me
yeah,
to lose a few. Uh, We'll put links in the description so people who are
that'd
interested
be
in
great.
MyStart Health can get that journey going. But tell us a little bit about what that experience is like for engaging with you. And then once I'm in your platform and once I'm engaging with a professional, how does it actually play out? And how will it play out in terms of realizing your medium to long term dreams for making the experience even more personalized and holistic?
Yeah. So today, as you experience it, you take the assessment on MyStart. We pre-qualify you, which we know based on a variety of factors, you're going to be most likely to be approved for the medication when you speak to one of our doctors. So you go through the pre-qualification. You'll then pick the program 1 month or 3 month. You'll pick a semaglutide or tirzepatide product, which are the two major GLP-1s kind of in the market today. I am excited about new ones that are coming down the pipeline, but we can talk about that next. So that's what we offer today. And you pay, you check out, and we guarantee that if you are not approved by the doctor, we refund 100% of the money that you've paid. So we guarantee that when you pay with us today, like you will receive exactly what you paid for. There are about 5 to 10% of people that the doctor will review very specifically and just decide it's not time, or they'll push you back to your PCP, and that's fine. That's part of the business, and so we'll just refund the money at that time. But as a part of MyStart, what I tried to make really simple is that when you pay with us, you includes everything. It includes the shipping, it includes the medication, it includes the doctor's visits, and the cost to you never changes over time. So we've built that into the program where once you hit your like monthly payments, they don't change. Or if you pick a 3 month program, it's the same price every quarter. So I'm not changing it. Medication costs will change over time. They do go up, but like I've built the program to a point where I'm willing to take less money over the long term that you continue to engage with us as a patient and you grow with us, because I think it's the right thing to do. And I think it's really simple to understand, and I'm not like shifting things on you. So that was my goal from the outset, is to make it as simple as possible. I call it our price lock guarantee. So like when you're in, and we'll continue to support you with everything you need to be successful on the program. So you've signed up, then you either go through two routes based on, and this is where I don't have control, right? The doctors will make a decision on whether they want to see you and do a video consult with you or a teleconsult, or they're willing to approve based on what they've seen on your medical intake. So you go through a pretty extensive medical intake at that point, where you'll go over your health history, you'll sign a consent form. So it's about 10, 15 minutes of time after you've signed up to complete those medical forms. They go directly to the doctor. The doctor reviews and makes that decision. And I think, in most cases today, unless you have a lot of baggage in your health history where they'd want to see you on video consult, they're approving and we're shipping the same day. So in a lot of experiences, like the experiences of friends and family that have joined MyStart, they're receiving the package within 48 hours of signing up.
Great.
And it comes sweet. Like it's nice. Like it's packaged nicely. It's all, in a big like wrapper sealed thing with like freezer bags in it, and like comes cold, delivered to your door so that it's fresh. And like, yeah, I love what we're doing right now from a delivery perspective.
Yeah. And, in the pipeline, oral versions of the GLPs, which will completely revolutionize the entire
I hope
treatment.
it continues to evolve that way. Yeah, we actually
regimen.
offer. Yeah, so sorry to talk over you. We actually offer an oral version today as well. So there's an oral sublingual option where you drop it under your tongue. I'm really interested to see where the evolution of that comes, because I agree with you. I think it's going to get better and better, and I think it'll be more effective as we continue to optimize the medications. Today, we don't see as great of results with the oral medications.
Yeah,
so the way they're processed through.
It's at the cusp, right? Yeah. They're working on it.
You got it. You got it.
But
it'll
be a revelatory, because when you simplify administration, adherence is going to go up, and more people will be more comfortable with that kind of treatment. I think another question listeners might have, because it's digital, you're dealing with a platform, is personal health information and data security. So I'm tacitly assuming that you can give everyone assurances that their personal health information is encrypted and insured in that kind of way for safety and security.
Yeah, absolutely. We take HIPAA very serious, and every member of our team is trained on HIPAA and certified on HIPAA. And we use secure databases for all of our data. Amazon has actually done an incredible job with that. Just in their, I don't know how deep you are on tech, but yeah, they've created a platform that allows you to do HIPAA security in a way that 10 years
if you're
10 years ago was a lot more complicated.
You're plugged into AWS in a nutshell. Okay, if just the listeners, if you're AWS compliant that way, you're pretty locked down, right?
Yeah,
right. So this is exciting, Matthew. When we were talking a little bit offline, you told me about some of your personal history, and you've intimated at that with the health challenges of your dad. You were talking a little bit about your business partner too. I don't know if that's comfortable territory to explore, but can you give a little bit of context from your personal vantage point in terms of how you're emotionally and personally vested in improving outcomes and helping folks out so that they can potentially avoid some of the challenges that you and your family have had?
Yeah, I appreciate you leading into that. There's a lot there to unpack. I think it's both the mental health and the physical health side of what my family history has been. I did allude to my dad passing at a young age, and I think a lot of that was ultimately anchored in mental health. That there was what came out when he got sick physically was the mental side that he had struggled with for years, undiagnosed bipolar. Where when you look back at the history of our experience of our family with my father, it makes a lot of sense. You see those moments of highs and lows, and he was able to mask it. He was able to just be the jokester, be the salesman, and mask the pain that he was ultimately experiencing in a lot of situations. And when your physical health declines, it's harder to mask that mental side. you don't have the strength to mask it. And so we got to experience that in a really awful way, yet like for me, created a lot of compassion for my dad and what he had been through his life. Um, so yeah, that in my business experience, I never really had an opportunity where I could like tie into that. I felt like and really like draw on that to inspire me until in 2020 I met a doctor of psychology who had this vision for changing access to transformative mental health services. And we together created a business called The Cheat Code, which is a for-profit and nonprofit mental health training and enablement business. So we would go into communities, inner city communities that don't have access to mental health, and we train individuals on the ground. So like clinicians or non-clinicians, like teachers, mentors that are in these communities doing the hard work of helping kids through the struggles of growing up in an underserved community. We train them on these mental health techniques. We've done a really cool partnership in Nashville with the Tennessee Titans, where they've developed their new stadium. They're building their new stadium where Cheat Code's going to have a mental health presence in that community. And Dr. Mondo has led that all the way through. And so I met him in 2020. He had the same experience with his father also being bipolar. His father's expression of that was alcoholism. But he and I bonded over that connection to our fathers and just wanting to do better by them. And for me, this journey with him has been incredible that was like the first trigger for me to realize that I could use what I've learned in business and apply it towards really making an impact on people's lives, which ultimately led me to starting MyStart. And now we're kind of bringing it full circle, we hope. He's created an entire curriculum on the mental side of weight loss. And so we are going to be tying in mental health into what we do at MyStart and offering curriculum around, how does your perception of self change as your body changes, and how do you relate to the world and the people around you as they see you different as your body transforms. I think there's a lot there. He actually did his PhD on the study of weight loss and the mental effects of weight loss. So he is I would say, foremost expert on the topic. And he did a whole project on The Biggest Loser, that TV show, studying those individuals and what they went through in that transformation. And so he just brings so much knowledge of how do we, really move the needle on mental health. And I think bringing it together with MyStart is going to be an exciting opportunity for us over the next year here.
Yeah, we've come a long way from a very patriarchal healthcare system where the patient goes to the doctor and the doctor just tells you how it's gonna be. And the perspective historically has been so limited and segmented, right? Like an ailment, a treatment, and not looking at the whole patient was tragic.
Yeah.
And digital helped kill two birds in that sense. The whole e-patient movement, where people started Googling their healthcare, right? It was a bit of a scourge for doctors, where patients are coming in with long lists and asking all these questions and playing doctor. But the overall benefit of this was patient empowerment. That you can understand your own health, and you can take command of your own health and not rely on a physician to merely treat, but you can be proactive. You can manage your health. You could prevent disease by exercising and eating well. And the sense of empowerment, I think, is critical, and it reflected itself in the healthcare community. So physicians, it behooved them to look at the bigger patient questions. Like, it's not just that you're coming in with this or that problem, but what are you eating? How are you sleeping? How is your mental outlook? And the connection between mind and body, which was central in Eastern medicine for thousands of years, is now percolating into the more Western analytical approach in ways, lastly, that fits perfectly into the technology, just like we were saying earlier, digital, personal, and now AI being able to understand all the data and take it in and aggregate it and analyze it in ways that an individual can't possibly do it. So again, another great benefit of this technology is to diagnose and be prescriptive in ways that do take in all of the information and not just bits and pieces.
I think that's such a good observation from you. I think that's the first time I've heard someone really put that timeline together for me of how it's evolved to this point, and the awareness then trickling into how we actually execute as a system. And I obviously change takes time. I still think we have a long way to go, but you're right. That access to information is freedom and creates real change in society, and we're getting there more and more. I feel like it's just keeps bubbling up and getting into the mainstream where now we talk about the food system and we talk about the dependence on medication and all conversations that were not happening 20 years ago.
Yeah, yeah. And I think that by you spearheading the facilitation and, in a sense, encouragement of better access, affordability, and doing this in a digitally convenient way, and it goes beyond mere convenience, where when you profile a patient and they go through that assessment, it sounds like you're evolving the platform and your overall business model to take in more and more detailed information about the patient so you could serve them better. And that
You got it.
busts it wide open in terms of providing that holistic, personalized care that is often so lacking. If you go into your HCP, it could be a PCP, it could even and especially be a specialist. You've got on average 12 minutes with the physician, and they're
Yeah,
staring into their EHR. They're not even a physician anymore. They're a typist. And it's tragic.
you're right.
And by shifting the attention back to the patient, and instead of just barfing out questions and manually inputting them, right? Like
Yeah.
a key punch operator, you're creating a connection with your patient, human to human. And I think the big takeaway that I'm getting from talking to yourself and other experts in the field is that AI's biggest benefit is actually the opposite of what a lot of people are alleging, which is that
Yeah.
if you could remove the grunt work and the data input, and if you could actually get all that information and aggregate it and analyze it and make it useful, that opens up professionals, especially healthcare professionals, to actually look the patient in the eye and have a conversation.
You got it.
How are you doing? I'm here to help. And the machines are all in the background. You don't need to sit there and stare at your screen and input. And platforms like yours help ease that kind of disconnect, right? I need it.
Mo-
I get it. I connect to my physician, and all the bells and whistles are operating in the background so that within 48 hours you can get your care. And as you ladder up to HRT and other indications and opportunities and even audiences, you bring in that technology for public health good, right?
That's
That's
right.
exciting and
You
fun.
got it. You hit the nail on the head. You actually gave me chills when you were describing how AI should be impactful because that's it. I think
Yeah.
that's where people are lacking in knowledge is like it actually should make us more human and allow us to have
Yeah.
more
And
time for human connection.
yeah, it
And,
opens it up.
everyone
There
thinks
was a
about
prediction.
robots.
There was a
Yeah.
prediction that AI would destroy radiology as a profession, right? Like you're looking at the histograms and you're analyzing tumor types, and now the machines are all going to do it, so everyone's going to get fired. But what they found at Johns Hopkins and elsewhere is that if the machines are doing all that stuff, then these experts can spend more time actually with patients and upping their game to understand what they're doing better and make that more human connection. So it's kind of cool.
I love that. That's
Yeah.
really cool. I got to find that study on John Hopkins. I
Yeah,
love
I'll
that.
send it. I'll look it
Yeah,
up.
please.
I'll put it in the description
Please
of the
do. Yeah.
podcast. Thanks for joining us, Matthew, on the Bald Ambition podcast. In 6 months, a year, let's touch base again to see how
Yeah.
you're doing. And then if you expand into HRT and other good things, we'll be all bald ears to hear about it. Thank you so much. And thank you folks for listening. Like, comment, share. I'll share the resource links and a bio of Matthew and the description of MyStart Health in the notes. And good
Thank
luck
you,
to you.
Mookie.
Thank you for
Yeah, we'll talk
doing
soon.
Thank you for doing what you're doing.